Hello, ladies. Today I want to welcome a very special guest, Dr. Tijana Evie. Tijana is the owner of Healthy Being Wellness in Atlanta, Georgia, where she specializes in prenatal, postpartum, and pediatric chiropractics. So today we are going to talk about all the myths and the benefits of chiropractics, both for you and your baby. So welcome, Dr. Tijana.
Thank you for having me.
Of course. So, Tijana, what is chiropractic used for, or how early should moms start? Either before they're pregnant. When is that perfect time for us to get our bodies into shape to prepare for having a baby?
So ideally, I love seeing moms who are trying to get pregnant. So before about 3 to 6 months before they actually start trying for the pregnancy is really the ideal time. So we kind of do preconception program to prepare the body for the pregnancy itself. And that's both between chiropractic adjustments and also lifestyle modifications. And then, is that always the case? No, not typically. And I see pregnant moms, some as early as they pee on a stick. Sometimes I find out that some of my patients are pregnant before their husbands do, so which is kind of exciting too. But we really want to, there's really time for chiropractic throughout the whole pregnancy, from the first trimester as they're dealing with their body adjusting to the pregnancy, sometimes morning, midday, afternoon sickness and all of that. And then second trimester as their body's starting to shift more and the center of gravity is changing and all of those things. And then definitely in the third trimester when they're accommodating for the baby, making sure that labor and delivery go as smooth as possible and all of that. So there's really, at any of those points, chiropractic definitely has a lot of benefits. And like I said, I see moms at any point in kind of those stages.
Yeah, so personally, I started seeing a chiropractor, I think in the second trimester. My hips were hurting and people kept telling me, the baby can get caught if the hips are not aligned, or they could be sitting incorrectly. So what are the common problems that you see on why women need to go see a chiropractor when they're pregnant? And then what are the red flags? Like, how should we know that we need to go see one?
So typically one of the first things that brings moms in the door is discomfort. And depending on the pregnancy itself and all that, that kind of starts at, different stages. But typically there's some discomfort and pain, particularly in the pelvis. So hip pain, pubic bone pain, pain when sitting, all of those kinds of things are typically when most moms are like, okay, like I can't be doing this the whole time. I need to get some help. So like I also work with a lot of the midwives in the area, and we work on kind of getting the moms introduced to chiropractic early on so they can be taken care of. And it just kind of makes it easier the earlier they start so they don't necessarily have to experience, the pain and discomfort. But usually that's when I see most moms, when something is already showing up as a symptom, and pain and discomfort typically tend to be the first ones. We also see moms who have heartburn, rib pain, all of those as babies trying to make their, get themselves positioned. And we also so I practice what's called the Webster's technique. And that is to ensure that the mom's body is prepared for the baby to be in optimal fetal positioning. And we work on the bony structures, we work on the muscles, on ligaments to ensure that they're in perfect position to make labor and delivery easier.
So what is perfect position?
So the optimal fetal positioning is with the baby on the left-hand side of the mom's body, head down with the bottom up, and where the back of the baby's head is inside of the pubic bone. So a lot of times you'll hear it referred to as LOA positioning. And kind of the adverse of that is the ROA, which is where the baby's body is on the right-hand side. And that still makes delivery really easy. So
that makes me feel so much better. So Trip is now 8 months old. And I always joke, so in the whole time he was in my stomach, he was on my left side, head down. So when he came out, I only have stretch marks on my left side, and my right side looks great. So I call myself two-faced because I didn't realize that that was an optimal fetal positioning, was to be on the left side. So I feel a little better about all my stretch marks being over there now.
Yes, yeah. And
So,
I was going to say, occasionally I see moms that come in because their baby isn't in the right positioning. So that's typically a baby that's breech, which means that the head is up and the booty's down. Or moms whose babies are transverse, which means that the body is across the belly. So the head is on like one side and the legs are on the other side. So we kind of have to work on getting the baby in a better position.
yeah, and that is something absolutely you can do, is to, I've heard the term spinning babies, but I'm assuming chiropractic is kind of the same method of that, or no?
So spinning babies is a completely separate thing from chiropractic, but spinning babies is another modality that we use to kind of help moms do some at-home modifications. So it's definitely something that we talk about, but it's kind of at-home modifications that they can do in addition to chiropractic care.
Okay, so I'm going to backtrack a second. So,
Okay.
The myth is that boys, if you're having a boy, it gives you heartburn, right? But you had mentioned that heartburn is one of those flags that you should probably come in and get seen. So is heartburn normal or not?
So I don't know if normal is the word that we use, but definitely common. And one of the reasons why it's common is because, babies take up a lot of room in there. And sometimes especially when they're on the left-hand side, they are literally pressing on the organs on that side. And the stomach happens to be one of the organs on the left-hand side most commonly. And so as a result, like the baby might be pressing on the stomach, making the contents in the stomach just kind of jumbled up a little bit, and it can create heartburn or even reflux and all of that. So because heartburn tends to be a lot of times more of an issue in like second and third trimester when the baby starts getting much bigger. So.
Okay. So to set the expectation for everyone, because I know that was my first time ever going to a chiropractor. It was when I was pregnant. So I was a little nerve-wracking, but I knew it needed to be done. So to set the expectation for all the ladies out there, what should they expect the first time when they come in to see a chiropractor and they're pregnant? Is there, are there particular motions that you always do, or the feeling sensation? What should they expect?
So typically pregnant women I know a lot of times when you go to a chiropractor, you'll get x-rays done. With pregnant moms, we typically don't do x-rays unless there's a major trauma that has taken place during pregnancy. But most of the time you will not get x-rays. There's things that we will avoid when adjusting a pregnant mom. Basically anything that's going to include a lot of twisting and turning, because we want to make sure that it's as symmetrical as possible, that the mom is able to distribute weight equally on each side. So something that you would see in like a regular adult adjustment, where we sometimes put a person on their side and adjust that way, you will not see that during pregnancy typically. So also the chiropractic adjustment with pregnant moms and anybody really is really gentle. So we are, our goal is to help maintain proper biomechanics and proper function. So we definitely want to be as gentle as possible, but also effective. So that's kind of the big thing. I typically recommend for pregnant moms to see somebody who's Webster certified, because being certified for that, the goal is to do specific things that you normally wouldn't do in just a regular adult female. So.
Well, thank you for that. Yeah, it's good sometimes to get that out of the way so we know what we're stepping into. Otherwise, that's what kind of keeps us from coming in the door sometime, right? Is all those, not facts because they're not, but all what people say on, oh, no, you're pregnant, you shouldn't be twerking your body in any which way, but really we're making room for the baby, right?
Yes, we're definitely making room for the baby, trying to get the mom to be able to, do her everyday, everyday living, and still be able to function properly. So, and also, have room for the baby to move, and also leading into labor and delivery, making that as comfortable as possible. So a lot of times you'll hear, a lot of times the assumption is that if moms go to chiropractors, they're wanting to have a natural unmedicated birth. And that's not always the case. And so just if the same way if somebody was planning a like a scheduled cesarean for whatever reason, or planning to have a medicated birth, or any of those kinds of things, it's still important for the baby to be in a good position, which means that it's also important for the mom to be adjusted to help ensure that.
So now you used to be, well, not used to, you are a doula.
I am a doula, yes.
So I have heard, and you can steer me wrong or not on this, that you can have chiropractic adjustments all the way up until, the day baby comes out or the day before baby comes out. Is that true? Or what is the furthest time that you should get adjusted?
So I've adjusted plenty of moms in active labor. So those adjustments look well, I've had moms in active labor that came into my office.
Go moms.
I know it's usually super quick adjustments, but sometimes during labor, if I'm adjusting somebody who is in labor, I will just adjust the upper portion of the spine, so typically the neck, and then we will check the pelvis. And again, checking the pelvis, making sure that there's plenty of room for the baby, for that exit to be as smooth as possible, and also the neck to help calm down the nervous system in general, so that mom can just focus on the actual delivery. So basically, like, I can adjust a mom up until the baby starts coming out.
That just blows my mind. But again, especially if something's wrong, you need to be there to make sure the baby can come out correctly, right? And just not get snagged on anything.
Yes, yes.
So are there certain types of deliveries that's more prone to? So, moms, are there certain factors or criteria that moms meet that need to see you more? Does that make sense?
Yeah, I mean, our goal is to have the mom kind of do everyday living with as little discomfort as possible. Sometimes one of the things that we see a lot are symphysis pubis dysfunction, which is basically pubic bone pain. And occasionally I will have mom that will refer to it as like lightning crotch pain. I mean, that's actually like a medical term. But the big thing is, like, the pain tends to be there pretty consistently. And so that's one of the things that we see commonly. Just general, pubic bone pain, hip pain, all of those kinds of things. We typically, as the mom goes through the pregnancy, we kind of go from seeing her, once or twice a month, just kind of depending on what her needs are. And then as we get closer to the end of the pregnancy, we typically see the mom, once or twice a week, depending on, how she's feeling and, what her needs are. Because every single patient is being seen based on their own individual needs, whether that's in pregnancy or not.
Okay, so we're going to shift gears. So now baby is out. Like I said, from personal experience, I was like, oh yeah, I'm going back. And then life got in the way. And I did not go back. And I regret it because my body aches like crazy. So why do moms need to come back after birth? And is there a time frame again? Like, do we have to wait the 6 weeks as prescribed by doctors, or what does that look like?
So no, you do not have to wait 6 weeks. I have seen quite a few moms like on the way from the hospital, they will stop in my office before they head home. Um, so there's not a waiting period that they need. I make modifications in how I adjust when the mom is, fresh after having the baby. Um, but there's nothing the mom necessarily needs to do. After the baby comes, the main kind of stress point goes from being in the pelvis to being in the upper back. So everything from holding the baby up to the chest, from nursing or feeding or any of those kinds of things, the focus becomes on the upper body. So, and mom is still in the transition period where the curves of the body that shifted during pregnancy go back to the way that they were similarly to before the pregnancy. So the center of gravity changes, the pressure points on the spine change, and all of that. So I really encourage moms, granted, as a mom myself, those first few weeks when you're home, the last thing that you're thinking about is going to get adjusted because you're, just trying to handle life with a new baby and everything. But at the same time, like it makes a big difference for each mom as well, to give herself a little bit of self-care, to also take care of herself because she's been, taking care of a brand new baby 24/7 too. So, and with any of my new moms, I make sure that I designate some extra time to check in about what their mental health looks like at that point, if they're getting help, to make sure that they have time so they don't feel rushed when they come in, so they have time to feed the baby while they're here or any of those kinds of things. So I try to make it as stressless experience as possible. And so they're not like rushing in and rushing out and all of that.
So, once postpartum, always postpartum, right? So
Yes.
is there ever a time where it's just too late for women? So, we'll go back to me. I'm 8 months. I'm like, oh no, I guess what's done is done. Is there a time where it's too late to go and see you?
Absolutely not. Absolutely not. So for moms that nurse for an extended time period, or like nursing at the breast or pumping or any of those kinds of things, it takes longer for relaxin, which is a hormone in the body that starts in pregnancy and then continues postpartum. If they nurse for an extended time period, relaxin stays in the system longer. And so the curves of the body don't shift quite as early as they do if somebody is in nursing for an extended time period. And not only that, over time, you go from carrying a newborn, 7, 8, 9 pounds, to carrying a bigger baby and carrying a toddler and baby wearing and, like all of those other things. So even though it may not feel like that immediate need is being taken care of, your body's still going through a lot of things because you're also like taking care of at least another person that's more or less still attached to you for a good few years. So I totally agree with you. Once postpartum, always postpartum. And I've worked with moms whose kids are teenagers and whose kids are, adults themselves and have children of their own. And I'm like, still postpartum.
Exactly. So I kind of want you to either prove me wrong or prove the myth wrong. So I would like you to prove a myth wrong or solidify it. Can chiropractics can it help onset labor or no? Or can it put you into onset labor?
Oh man, that's such a hard question to answer. So in my experience, I have seen plenty of moms get adjusted and within 24 hours have their baby. Has anything that I've done to do anything to kind of contribute to that? The only thing that I know for sure is that the mom's body was aligned properly, the baby was in the right position, and the time was right. So that's pretty much all I can ensure.
So there is a chance.
There is, okay, basically, like there is a chance.
It's probably less painful than getting swiped, right?
Yes, yes. And one of the things, like I've had a couple times over the years, I've had somebody come in and they're telling me I'm going to have to be induced tomorrow if I don't get adjusted. They're telling me that I'm going to be induced tomorrow, and like, will an adjustment help? And I was like, I mean, will it for sure put you in labor? Like, I cannot guarantee that. Could by chance it happen that way? Sure, but like, I cannot make that guarantee at all. So all I know is like proper alignment for mom, optimal positioning for the baby, and the timing being right, and we're good to go.
uh, so thank you so much, Dr. Tijana. Is there any place our listeners can reach you at if they have questions or are seeking your services?
Absolutely. So my website is healthybeingwellness.com. I am also on like all the social media channels, Facebook, Instagram, and I would love, I was going to say, even if somebody's not in my area, I would love for somebody to reach out and just say hi. I try to post a lot of lifestyle things that people can try. Definitely really passionate about connecting moms and addressing motherhood in an unfiltered way. So, and now that we're in, quarantine or isolation, there's going to be a lot more online content coming because that's what happens when I'm sitting at home.
True.
And when I say sitting at home, I mean also having a 2.5-year-old toddler climbing all over me and nursing and all of that fun stuff.
Well, thank you so much. I know our listeners are going to take full advantage of this, and all the links and to your social media and notes will be in the podcast notes for anyone to reach out to you. So thank you just so much for being on.
Thank you so much for having me.